Sky News has seen the first comprehensive analysis of patients needing critical care because of coronavirus, and it shows why hospitals are under such pressure. The Intensive Care National Audit and Research Centre looked at 196 patients admitted to intensive care in England, Wales and Northern Ireland. The numbers steadily increasing since the start of the month. The numbers are still relatively small, but there are some interesting trends. 139 of them were male. That's 71%. Their average age was 62, not as old as you would expect. In fact, 10% were in their 40s, 5% were in their 30s. But it can affect people who are even younger and were perfectly healthy.
I had zero symptoms. I arrived home on the 16th of March, a Monday, and by Tuesday I had horrific shortness of breath and an extremely hot temperature. By Wednesday, it had exacerbated, really struggling to breathe, insanely high temperature, convulsions in bed due to my body fighting the infection. On Thursday, I phoned an ambulance, and I've been in hospital now this is the 5th day.
3/4 of the patients needed mechanical ventilation to help with their breathing in the first 24 hours of being admitted, underlining the importance of sourcing enough ventilators in the coming weeks. So how did they do? Well, 163 of the patients are still in critical care. 16 have died, but 17 have recovered and have been discharged. There's more comprehensive data on those 33 patients because, dead or alive, they have technically completed their treatment. Half of them spent 9 days in intensive care, underlining the pressure on beds. And it wasn't just help with their breathing that they needed. 79% required basic cardiovascular support that could include drug treatment or the insertion of tubes into their blood vessels. 18% needed more advanced cardiac care, such as a temporary pacemaker. And 12% needed kidney dialysis. These are very seriously ill patients needing expert care, and as the epidemic gets worse, more staff will need to be retrained to give life-saving care to a growing number of people.